Isn't it amazing how something can get better by staying exactly the same? How's it going, everyone? I'm Joey Giangola with Giangola Insurance. In today's health insurance break, you're going to find out why Medical Mutual's network of doctors just got better by not doing anything at all. Sounds crazy, I know, right? Well, I'm going to tell you right now. I am actually thrilled to be able to tell you that I was recently talking with a few representatives from Medical Mutual, and they confirmed for me that they will be keeping their network exactly, well, I don't know about exactly, but pretty much the same as what they have now. This is great news for you because from what I've been hearing from other insurance companies, that's not going to be the case. If your insurance company's network of doctors and hospitals is fantastic, robust, whatever word you want to use to describe large and in charge and whatever else have you, well, it's very possible that that might not be the case here very soon when the healthcare reform, Obamacare, Affordable Care Act plans take over at the start of 2014. What this means is there are health insurance companies who are considering or in the process of eliminating multiple hospital networks within a certain metropolitan area. That means that if you live in an area where there are 1, 2, maybe even 3 major hospital systems that you generally have to choose from, you may only get one of those in network now after all of the healthcare reform changes. It's time for the bad news. If you are saying to yourself, what's the big deal? If you generally only use one hospital system and it's in your insurance company's network, you might not care. You just, like, Joey, I don't care. Stop talking. The reason that you're going to want to be careful about this moving forward, and the only time that you could potentially get into trouble is for that unexpected condition that obviously has not come up yet, and you find yourself getting referred to a doctor that is outside of that hospital system. Then you will face the very difficult challenge of having to decide to pay that higher out-of-network expense for that visit, that treatment, that whatever procedure that is going on, or opt to go with a different doctor that may not be of the same quality level, whatever else have you, however you want to phrase it. Go with that different option, that other option instead. Also, don't forget, this is a little disclaimer that is to say that you aren't able to not receive treatment from these doctors and hospitals if they are out of network. Like I said, you're just going to have to pay more. So don't take this as you are forbidden from seeing them and these big bad health insurance companies are saying you cannot. Well, that's not true. They're saying you can, but they just haven't worked out as nice of a deal for you. So what's the bottom line? Well, the bottom line is I actually just let out a big sigh of relief when I heard this information from Medical Mutual directly. Because what I've been hearing and what I've been kind of alluding to, like I said earlier in this video, is that other insurance companies are not considering this as an option. They are making drastic changes to their networks, and you're going to be in a very big surprise for when you see what they look like. Now, again, I'm not at liberty to discuss the full details of this, but when I am able to, October 1st at the very latest, you will hear some of these changes that are coming down the road and why they're going to greatly impact your health insurance decision moving forward. One of the main reasons that has been floated out for these smaller or narrower networks, to use a hip industry term, is to help keep the cost down for you to make the health insurance premiums more affordable. At the end of the day, you're going to have to look long and hard at the actual differences between the health insurance policies and companies that you're considering moving forward inside of the marketplace or even outside of the marketplace, because these networks are going to greatly impact that. If these networks of doctors and hospitals are one of the only things that stands out as a major difference from these policies or companies that you're considering, well, you're probably going to choose the one that has the wider selection to choose from. So I'm just going to leave you with one question to kind of just see how you're feeling, what your thoughts are on this scenario. What does your doctor or hospital mean to you? Would you be willing to give them up just to save a few bucks on your health insurance? Feel free to leave a comment below or wherever you're kind of watching this video. If you like this video, well, feel free to like it if you found it helpful. I'm not saying you have to, but if you did. If you want to make sure you don't miss another one of these videos, also there is an option to subscribe, which no pressure, but if you want to, feel free to do that as well. If you want to know more about what's going on with your health insurance company and how they're going to be acting with inside of Ohio's health insurance marketplace, and if it's going to be a place that you're going to need to be looking towards for your health insurance, well, I'd go ahead and encourage you to download our very free guide, How to Understand Ohio's Health Insurance Marketplace. You can do so by clicking directly on this ebook right here or in the video's description below. But of course, I do want to thank you for taking the time to watch this video. I greatly appreciate it. And as always, I am Joey Giangola with Giangola Insurance. Take it easy, everyone.